So my name is Philippa Boulle and I'm working in MSF Switzerland Medical Department. I've been there for 2 years as the non-communicable disease advisor. NCD stands for non-communicable diseases, but they're also known as chronic diseases. And so these are diseases that are of long duration and not transmissible from person to person. And so the classic diseases are things like hypertension, cardiovascular disease, diabetes, epilepsy, and so on. So it's quite a broad range of diseases. We've worked on what will be our essential list of medications, so the key medications, again, that provide the most important drugs but are not too expensive to be able to provide care to the bigger number of patients who need it. So we've developed guidelines adapted to our context. So these are very much based on international evidence-based guidelines, but they tend to be from high-income settings, and we need to adapt them, simplify the approach, have a more rationalized, cost-effective approach that's adapted for a humanitarian setting. And the other challenge of chronic diseases is that patients need to self-manage, they need to take care of their lifestyle and diet. Now, in the context in which we work, this can be extremely difficult. Patients may have limited control over their lifestyle risk factors, they may have limited access to good foods, limited resources to afford those foods, and so trying to manage those can be complicated. They're often living in crowded situations, the sanitary conditions may not be so good, they may be exposed to increased infectious diseases that can complicate their disease management. And as well as that, they've often come from very traumatic situations. There's a high level of stress. Lebanon, this is a very traumatized population, the Syrian refugees who fled conflict. Many of them have family left behind. Many of them have lost family during the conflict. They're living in not great situation in terms of the shelter that they have, the number of people crowded into that shelter, their access to food and so on. Yet, interestingly, we still find people seeking information on particularly how to manage their diet, which is really encouraging. People still trying to see how they can best manage. But some of these people, for example, we know will be eating primarily bread most of the day because they don't have access to, it's expensive to afford other things and their funds are limited. But our team has tried to work out how to support patients with this. So they've tried to understand what local foods exist, what people can afford, and to develop some simplified leaflets for patients with an example of a diet for a day using local foods that would be the most healthy. And try to make suggestions where you can. So sugar can be very commonly used in tea, so trying to encourage patients to sit down. So often it's very simple suggestions, trying to make the best of what you can.